Just a little bit of history. In 1998, Alan Trounson and Gail Jones travelled to Athens to introduce to Costas, on my recommendation, how to grow embryos out to day 5. Because here in Melbourne, there was a reluctance to put patients through that process because they may not have had a transfer or any embryos to get to day 5. And Costas took this up with enthusiasm, and Gail Jones and he developed a fantastic system where the pregnancy rates were very, very high. So high that when he published the results, they reported him to the medical board that he was lying. So we had to fly out to Athens at short notice to go on radio and television to support these findings that they were great. So there are a number of Monash IVF doctors in those articles, and it's a credit to Costas that he's listed in the achievements of IVF. It sounds difficult, but it's actually quite easy. All you have to do is make the decision to go there, and we organise everything, apart from your airfares and your accommodation. But there is some cheap accommodation if that's a problem. Some people like to stay close by. Yep, Anna.
Can you just explain the matching process a bit more?
How we match the characteristics of the donors.
Yeah.
Yes. We try to match the characteristics of the donors with those. I mean the eye color, blood, skin color, complexion, build, weight, height. We try to do this, and we're doing very well, I think, over these years.
That's why it's important to send some photos over as well when you send all your documents to Greece.
We can choose the nationality if you want. The majority of donors come from Greece, Bulgaria, Romania, and some Russia.
They pay them in Athens, so it's quite a substantial amount. So if you're a university student and you need some cash, donating some eggs will give you quite a bit of money that will last 6 months?
Yes, 6 months.
Last 6 months on an average wage. So there's an abundant supply of eggs. Whether they would supply more eggs for a second baby, it's unlikely. But if you have frozen embryos, then you're very, very lucky. And the reason why the success rates are high is that the donors are young.
If I could ask Maria, how do you screen the donors, either male or female? Do you screen them, or can anyone be a donor?
No, of course we screen them. Yes, of course. There are a lot of donors who come to our clinic because they learn it by mouth to mouth. And of course we don't accept all of them. Dr. Pandos, it is worth noticing that Dr. Pandos examines all these donors gynecological. We are doing all the blood tests, they can interview with them.
Maria, the process in Athens is much lengthier than the process here in Melbourne. So if you found a donor from Ferntree Gully and you brought her to see me, I would do the due diligence and I would order a basic set of tests that all the doctors in our group have agreed upon. They go further. So they're very well screened. So I believe it's a matter of trust. I trust him and he trusts me.
Exactly.
So he doesn't interfere with I had an email from a patient who's got some embryos in China, and she asked them if they would follow my protocol. And their answer is, we don't deal with any other clinics in the world. You do it our way or no way. That was their attitude. And so it is difficult with some clinics to be able to help them achieve a pregnancy.
The extra eggs that we will have there, it can be sent down to Australia?
No, the law, it's completely anonymous. So the only way you can get an embryo into Australia is for that donor to go on the register here. And the Greek government won't allow it because it's completely anonymous. So if you have 10 eggs, if you get 3, you might get more, you might get 5. For a young 18 to 30-year-old, the chances are you'll get 5 to 6 quality embryos from that donor, which is fantastic. The average, when you look at all the age groups, is to about 2. So you're going to do very well. So if you have frozen embryos, you have to go back to Athens. But you don't have to go. You can just send your wife. With the oven ready for the transfer. Save some money, save some money. Any other questions for Maria?
The legal documents that you have to sign when you get there, is it possible to get them in English before we go?
Yes, of course.
Well, you do sign consent forms here, before you travel. But I suppose it doesn't include what you would do with the embryos should you die.
The European laws or rules that you have to follow?
Yes, they have their own rules.
And is it possible to get them here so we can look
I'm
at
sure we could get
We can
copies.
send them, yes, of course. We
Yeah.
can send them.
Yes.
Is there a way of sending the sperm so you don't have to go?
Yeah, it costs you $3,000.
Oh, good.
But if you want to do that, not a problem. We can send the sperm. Yeah, but that's okay. We have couriers that will deliver the sperm. We collect it here, we freeze it. You pay the $3,000 and it's delivered to the clinic. And when you go there, please leave some sperm there.
Yes.
Even if you have to pay a small fee for the frozen semen, leave some there because it makes it a lot easier next time around because they can create the embryo before you even travel.
Just in case, yes.
Yeah,
Sorry, Nick, how much would it cost if you had one failed attempt to go back there again?
same.
Same.
Yep.
3,000.
Well, it's the airfare, the accommodation, and the fee is €6,500. So I've got a lady who's pregnant at the moment. Well, not my lady, but a patient of mine, and she has been 6 times. So it's a lot of money, but she's now pregnant and being cared for by somebody else, and is going to have her second baby. But she had 4 pregnancies from those 6 goes, but unfortunately she had a miscarriage. So there's always that possibility that you might go over there and come back and you're very happy, but the pregnancy may not be ongoing. Just first here, yep.
How many embryo they actually put in?
All right. The reference to 8 that Madeline made, in the early days of IVF, before we had genetic testing, if I had a 40-year-old woman and I had 6 embryos, I'd put all 6 back. I only had a few sets of twins because the quality of the embryos were poor. When we started testing it, my colleague said you can't do that anymore. But Costas, when we first started, I can remember this vividly. I'm in the ward at Jesse McPherson Hospital. There's triplets, quadruplets, triplets. I'm thinking, I'm going on a holiday. This is too much stress for me. And of course, what makes it worse that one patient with quadruplets decided to reduce down to 2, but lost all of them in that process. Now she's got a set of twins, so she's happy. So over the years, I've convinced Costas to put back 2, and that's what happens. He'll put back 2. Just watching, because sometimes he sneaks in a 3rd one. You know, when you're not looking. No, I'm joking.
Now the law says that we have to place 2 embryos.
Okay.
The law. Yes.
So we have a single embryo transfer policy here in Melbourne, but we sometimes put 2, especially if we're doing day 3 embryo transfers.
It's happened that you put 2 and it's split. One of them.
I've got a lady at the moment with quadruplets. So 2 were put back, and no, you put back 3. One's okay, a singleton. One has split, and the other one is a trapped embryo, which now no longer has a heartbeat, so that won't be a problem. But so she's going to have identical twins and a singleton. So you're quite right, that's about a 4% risk rate. When you put, and even if you put 1 embryo back, there's a chance. So most of the patients who go for donor oocytes, if you were to have sex on the plane or on Santorini, the chances of a spontaneous pregnancy is probably pretty low, if you know what I mean. So it's usually from...
How many days actually the woman will have to stay to get the blood test?
No, you do the blood test in Melbourne.
You do it.
Some patients fly out the next day after the transfer. You don't have to stay there, but some people want to have a holiday. So if you have complicated regimes and you need intralipid, the clinic will organise for you to have intralipid once you're pregnant if you're going to stay a bit longer.
So you can fly the next day.
You can fly the next day. Flying doesn't do anything.
What's the minimum amount of time you can stay?
You've got to stay 2 weeks.
2 weeks.
It used to be 3,
3.
but most patients need to stay 2 weeks.
So is it the transfer usually done on a day 3 transfer?
Day 5.
Day 5.
Day 5.
We imitate nature by blastocyst.
And Costas does all the transfers,
Yes.
and he doesn't use ultrasound.
Yes.
So in the old days, we never used ultrasound, and I'm not too certain whether that makes that much difference. If you have the feel for where you're putting the catheter, most times it's right. But they have done studies which show that some of the embryos end up in the cervical canal. So it is reassuring to see the tube go into the cavity of the uterus. It gives the patient heart, and it helps the doctor know that he's putting it in the right place.
Dr. Lolatgis, you yourself in one of your newsletters spoke about comprehensive chromosome screening as a new technology and the benefits of that. Is that provided at Jexus, and in what circumstances would you recommend it?
Well, I don't... if I have a young woman who's 18 or 20 coming through for an IVF program because she's got blocked tubes, I might suggest preimplantation genetic screening, but I don't push it, because if she has 10 embryos, one will be abnormal probably, the rest will be fine. So it's an added expense and a delay. I believe that your best pregnancy chances occur when you transfer an embryo that's frozen into a natural cycle or a medicated cycle. I do no fresh embryo transfers unless the patient insists on it, because the lining in the uterus is conflicted, it's confused because of all the drugs we've used in a stimulated cycle. And the pregnancy rates, when I introduced this back in August, have soared for my patients.
Is that emulated increase though? So I don't think...
Well, they do a fresh cycle, but your uterus is not confused, because I have managed your uterus. Okay? So your uterus is not conflicted. Your uterus is beautiful, it's ready. Give me the embryo, thank you very much.
If your partner doesn't produce sperm over there, what happens?
They take a big bloody long needle and stick it into the testicle. There's always a solution. Or they'll freeze the eggs. Any other questions for Maria?
How do you test the embryos before you transfer them?
They're not tested. No, I'm correct there?
Yes.
Yeah, they're not tested. Testing adds cost, delays the process, and you may have to then go back. So if you wanted to do that, you would ship your husband's sperm over there, make the embryos, have them tested, get them frozen, and then we'll send you over with the oven ready. That's a much more economical thing to do if you want testing. But if you have a young donor, I think you're probably overreacting.
Just with the whole DQ alpha genetics, so obviously we've got the same gene. So without donors over there,
They're not tested.
They're not tested. So
No,
we wouldn't
it's
know.
very unlikely that that would be a problem, because I've now treated so many patients who share DQ alpha gene with donor eggs and sperm without an issue. If you share two genes, then that's a different ballgame, because even if you put a embryo that's made out of a donor egg and your husband's sperm, the chance of a pregnancy is less than... I spoke to Jeffrey Shearer in Las Vegas, and he wouldn't give me a percentage rate, because it's very rare, so probably less than 1%. So in that situation, you use donor sperm, donor egg.
Is there a minimum number of eggs, or is it just however many?
Normally, you get 10. So if you had a really good donor and she got 20, they would divide them up between two recipients. So you get 10. 10. Now let me give you an example. You can buy from Monash IVF through the World Egg Bank 7 eggs, which will cost you $28,000, and you might get 1 embryo for transfer after that with a 30% pregnancy rate. Pardon? And you have to register. Now why would you do that? For less money, you can go to Athens with a 75% pregnancy rate.
Is there something if the donor was to produce a very small amount?
Yeah, yet another donor. In fact, one of the first patients I sent, she's a policewoman, I think she was the first patient, they got 5 eggs. And Costa said, not good enough. So she stayed on her hormone replacement therapy, because you don't start your progesterone until we see how many eggs the patient has. And so once we know how many eggs there are, then you start the progesterone. So if there aren't a lot of eggs from that donor because she's a poor responder or they had difficulty collecting eggs, they won't use those eggs. They'll move you on to another donor.
I'm just going to take a different tack. The laws in Europe about donor anonymity, have there been any queries, especially, it seems to me that it protects the adults, it doesn't protect the children. In the future, children might not know their...
That's the law. Spain and Greece are the two main centres in Europe that provide donor eggs. Germany doesn't do it. Italy doesn't do it. Correct?
Yes.
And in Italy, you know, in Italy, I have a colleague there. He collects the eggs, and if the egg is mature, it has a little bump on its surface called the polar body. He takes the polar body off the egg and looks at the chromosome makeup of that polar body. So if there are 23 chromosomes in that polar body, he knows that egg is normal. So he'll fertilise it, because he's only allowed to fertilise 3. And that's the law of religion. So,
I thought that it changed initially a year ago, so it hasn't changed enough.
no.
Because it was completely illegal.
No, it was never completely illegal. It was always there. I've done egg pickups in donors illegal, but IVF's not. But they haven't changed that law, and it's hard in the other countries that were mentioned.
They register their, you take their names, so you don't be accessed many years from now. An adult, the child that grows up can access.
But if you can find the same donor, yeah.
No, just so a child born from me could access the donor's name.
If the law changes, Maria, if the law changes and you have a list of all the donors, can a recipient who's had a child access that information?
No,
At the moment, no.
What's the possible case scenario if, say, the first donor didn't provide enough or that weren't good quality, then to do, say, another donor, would those donors' eggs, they wouldn't be fresh, would they, for the first transfer, they would be frozen from another collection previously?
No, they've got people cycling all the time.
Sure, okay.
So if you had a donor that was no good, he might have a donor that is earmarked for somebody who's in Athens. So he'll just take those eggs, correct me if I'm wrong, and that Greek patient will be postponed. Not today, Josephine. So otherwise the system won't work. You go all that way and you get 4 eggs and you know, you might get no fertilisation. You know, you've spent a lot of money. So we try to maximise the chances for it.
The donor, I guess, sort of looked off the couple.
Well, they're all worked up, so it's very rare not to get 10 eggs because they're young and they've all been screened. Like I screen, if somebody comes in to be a donor, I do the ultrasound and the blood tests, and I often say to the recipient, no good, get another donor. She's only got 5 eggs and we may only get 3. And you can't spend all that money because it's about $13,000 here in Australia for a donor cycle for maybe no embryos for transfer. So you've got to be tough. Yes, sis?
So if the first donor doesn't have enough eggs and they use somebody else, they have a list of, would be the same sort of...
Yeah, he would try and match up. They've got multiple people coming through. I had one patient who got to Athens and I had a panic phone call from Costas because she'd been given wrong information and had started her progesterone in Melbourne by one of my staff and arrived out of sync with the donor. What was the solution to that? I paid the airfare next time round. It was an expensive lesson. So now I make those decisions about when they can fly.
Saying pregnancy isn't successful and you hang around in groups.
Yep.
Is there provisions to go for another one, another trial, another...
Yeah, you can follow up with another. If you want to do, I have patients who go there and they plan to go for 3 months or 4 months, and they've got relatives over there, so they do the first cycle. If it doesn't work, they have a period, they start their hormone replacement therapy again, and they're matched up again. So it's a lot cheaper to do it that way than to fly back home and then fly out again. If you can. Well, you'll you're not pregnant, you'll have a period, then he'll probably start you on the hormone replacement therapy rather than the pill HRT, and that takes about the transfer, the period, the transfer 4 weeks. Yeah.
What are the side effects of the hormone replacement?
Well, that's a good question. For those people who've been on the pill, it's a bit like the pill, so sore breasts, maybe some weight gain, but you're only on it for 21 days. So I had a lady who rang me because she'd broken out in a rash, so that can happen. But usually most patients are asymptomatic. So your period starts, you go on the pill, 17 days into the pill you start a nasal spray, they overlap, the pill stops, you have a little bleed, the nasal spray continues, we do a blood test to make sure we have control of your body, and then we give you instructions to start the hormone replacement therapy. The problem is that, not the problem, but if you conceive, because it's a medicated cycle, you have to stay on the HRT until 13 weeks. If you conceive. Because that's supporting the placenta. So if you stop the HRT, then the pregnancy will come away. So you need the hormones to support the early pregnancy. So sore breasts and weight gain are the main symptoms. Sometimes a bit of nausea.
Maria, if I could just ask, basically, if we have any questions, should we just direct them all to you with regards to Genesis or to Danae?
Me and Danae too.
So just email, is that your preferred?
Yes.
Or phone call?
So I have spoken to Maria about responding to the emails.
Yes, thank you.
Because we know they're a little bit tardy. And so I've asked her to make a commitment to the Australian patients so that when they send an email, that they get an answer back within 24 hours. So the good news, eggs are readily available. It's a bit expensive. Great pregnancy rates. How many went this weekend? 7? 7 patients went left for Athens. Girls? Oh, about 7? About 7. And so, you know, it's a growth industry. And you just have to make that bold decision to go down that pathway. It's not easy. So what I tell my patient is that, and you may have heard this, I mean, my dad got killed when I was 5. So I had a stepfather. He was fantastic. I held him in my arms when he died. I never thought once that we weren't genetically related. He was such a good dad. So that's what you should think when you see that baby in your arms. And I've had patients, they come in, there's no way I'm going to use donor eggs, doctor. Smoke coming out of their ear, out the door. And there's one lady that, her first name is Lydia, I won't tell you the surname. So I've delivered her baby, and she looks at me and she goes, this is better than anything I could have imagined. And so it is a journey, and sometimes the decision making is not easy, but there's always a solution. Always a solution until you decide that that's the end of the journey. Any more questions? Well, thank you for the 2 hours. Maria, thank you very much.